Welcome, everyone, to another edition of the Sports Medicine Update, a weekly podcast. Yours truly, Jerry Riles, and the Honorable Dr. Chad Prodromos. Doc, how are you?
Having a great day, Jerry. How about you?
I'm doing fantastic. Dr. Chad with Prodromos, Illinois Sports Medicine and Orthopedic Center's weekly podcast, and we always look forward to joining you and having you on board because of the knowledge that you bring to the table, Doctor, the insight that you bring, your perspective, and just to help the average person watching this podcast, listening to this podcast, bring a little bit more education to their world of sports as far as sports injuries and sports medicine are concerned. We don't want anyone to get injured or get hurt while they're out there maybe shooting the ball in the driveway with their youngsters, or out there on the golf course, or maybe some skateboarders. And with the beautiful summer months here in the Chicagoland area, if you happen to be out skateboarding or riding a bike and you suffer some type of injury, we certainly don't want that to happen. But if it does, Dr. Chad Prodromos is here to support, help you, and guide you and advise you throughout your journey. So, we go to the NBA, Doc, and we talk about the bubble and how successful during this pandemic and the coronavirus era that we're currently living in. And we see that the NBA in that bubble down in Orlando are doing a pretty decent job, a pretty good job as far as the testing are concerned with the players and, the low numbers. We see it's not working so well in Major League Baseball. So what happened with the Marlins down in Florida, and of course what's currently going on with the St. Louis Cardinals having to cancel games with the Cubs and the White Sox. I think they're expected to get underway back in the business sometime this weekend. We see what's happened with the National Hockey League up at Canada. They're doing a great job controlling everything, and still remains to be seen what happens with the National Football League. But we know on the collegiate level and the high school level, fall sports has been effective. But as far as the NBA bubble is concerned and the coronavirus and everything that's happened, there's other news and speculations coming out of the bubble, and we go to Philadelphia with the 76ers, and one of their up-and-coming stars, the superstars, Ben Simmons, unfortunately suffered an injury that, put him on the shelf. Joel Embiid, their other star player, had ankle injury, but the surgery, so to speak, and you can correct me on this, I guess we got a call from, or a response from one of our viewers to ask, the procedure that Ben Simmons underwent, some loose bodies being removed from his left knee. Now, the average person watching and listening to this podcast go, what's a loose body? How do you remove a loose body from an athlete's knee? Is this a new term? And can you shed some light on this loose body treatment that Ben Simmons with the Philadelphia 76ers underwent?
Sure. Actually, it's a really old term that goes back before the era of arthroscopic surgery. Usually, we see it in the context of older people with arthritis. But in his case, and by the way, in all cases like this, I have no inside information, and if I did, I couldn't share it anyway. I just read the papers like everybody else. But what's pretty clear from what's out there is that he had something called a subluxation of his kneecap. So the kneecap or patella sits in the front of the knee, but it's encased in structures called retinaculum. They're kind of like ligaments that hold it in a little groove. And the kneecap can tend to go out of the joint toward the outside. And if it goes out completely, it's called a dislocation. If it goes out partially and goes back in, it's called a subluxation. By all the accounts that I read, he had a subluxation. It's in susceptible people. You can get it from twisting your knee. It is more often seen in people who are looser jointed than others if it's atraumatic, if you don't get hit with something, which I think was the case with him, although I'm not sure. So what happened was, apparently, is that the kneecap went out and went back in, but in the process of going out and going in, and you kind of got your, the kneecap, and it kind of goes out like this and goes back in. In the process of doing that, you can knock off a piece of cartilage. So I don't want this to be an anatomy class, but the cartilage terminology is a little confusing because there's two kinds of cartilage in the knee. There's what's called articular cartilage that coats the bone, kind of like Teflon on a frying pan or like a non-stick coating, which is what it is. It lets the knee glide. And then there's meniscal cartilage. When they talk about having a torn cartilage, often they're talking about that. So this is the articular cartilage that coats the bone. So what almost certainly happened is a piece of that got knocked off and is floating around in the knee. Now, the key thing to know about this is actually that happens reasonably often with this problem, and most of the time we don't take it out. Usually just kind of scars down. So I don't know if they took it out in his case, because if it's a big piece, it'll float around and can cause problems. But the other thing is, the loose body itself is usually not the main problem. The main problem, if there is a main problem, is the crater that it came from. Because when a piece of cartilage is knocked off, you've got exposed bone underneath. And when you have bone gliding against other cartilage, this can cause all kinds of problems. So I don't know. Maybe this is just a small loose body that they took out just because he's Ben Simmons. It was a good sized piece. Now, when you go in to take it out, sometimes you will do something called a microfracture to the remaining cavity. There are other things you can do too, and I haven't read anybody describing this, but there are other techniques you can do. You can even take a biopsy of your cartilage and send it off and grow it and put it back in to grow it. So it was just kind of interesting because it was first reported as a loose body, but then he was reported as being out for the season. To just go in with a scope after a subluxation and take out a loose body, usually the recovery is very quick. However, if the crater where it came from is of significant size, then the recovery won't be. So, again, I don't know for sure, but it'll be interesting to see. He's kind of got jeopardy in a couple of places going forward. One, if that crater is big, it can cause problems. And that's the thing, by the way, that derails NBA careers in general, is the articular cartilage just gets beat up, and pretty soon you don't have much coating anymore. But the other thing is, the fact that it's subluxated once, unless you surgically go in and tighten things up, which I don't think they did, you're kind of prone to having it happen again. The other thing is that the kneecap is part of the quadriceps mechanism. It's related to that muscle, and that's where you get explosiveness from in jumping. Not really running, but jumping. Running comes more from your hamstrings. So you don't know a guy like Ben Simmons, who's just an unbelievable athlete. I think everybody knows. Guy who's got the size of a center and the terrific speed and all that. You just have to wonder if that extensor mechanism, it's called, the quadriceps tendon, the kneecap, the quadriceps muscle, if that is rendered inflamed, then that's the kind of thing that can kind of cut into your athleticism. And just by comparison a little bit maybe. So Derrick Rose, very explosive athlete, super athlete, right? And tore his ACL. So the ACL is a ligament that destabilizes the knee. And if you fix it, and he had a very good surgeon, did a great job, and it's been fine, that doesn't necessarily lead to a loss of explosiveness. It can, but there isn't anything inherent to the ACL that does. But if you've got cartilage problems on the back of your kneecap or the socket for it, that's the kind of thing that can directly lead to a loss of explosiveness. I'm not saying it will happen. I hope it doesn't happen. But, sometimes that kind of thing could just be the beginning of, attrition of the knee.
Hey, Doc, that's great breakdown, a great analogy. As far as the diagnosis is concerned, regarding Ben Simmons, did he experience, in your opinion, your knowledge of this, did he experience discomfort, or does this cause, excruciating pain that it needs to be addressed? Because as athletes, younger, older, in between, when you have an injury or an ailment, in most cases you feel as if, okay, I can work myself through this pain. For instance, when you get a Charlie horse, that muscle tightens up, and you figure, hey, I can tough it out, and I can work it out, and I'm fine. I think I shared a story a few podcasts back where my son tore his ACL, and for a good month and a half, 2 months, he thought it was just a knee injury, and of course, once he went in, After the X-ray with the MRI, it revealed that there was a torn, his torn ACL. But for Ben Simmons' situation, is it a discomfort where an athlete can feel like, or he felt like, hey, I can just stretch this out, run it out? Or is it excruciating pain that you say, hey, we've got to address this immediately because it's a lot more serious than what we believe?
Yeah, so in some of it's a great question, and in fact, there's a spectrum, kind of a continuum. The subluxations usually are not real painful. The dislocations are, because there's this thing that's called the retinaculum, kind of like a ligament, and if you dislocate it, usually it ruptures. If you subluxate it, usually you don't, so you usually don't get a lot of bleeding or acute pain, but it's variable, and you can. So, I'm in someone like him, they're going to get an MRI in every case. And so, pain or not, they probably wanted to give it time to heal on its own, and they probably, I guess, saw the loose body, said they wanted to take it out, or it might have been, it might have been big enough that they wanted to do something to address what they have disclosed. And I mean, why should they? It's nobody's business but his. But usually it's not terrible pain. The other thing that can be bad is if it subluxates a little and you go back too soon. It's kind of like with shoulders. The shoulders do the same thing, except with the shoulder, you're not running, so it's a little better tolerated. So it probably could have been, but in most cases with a subluxation, it's not horrible pain. But maybe it was a good size loose body, or maybe he felt, you can feel this thing. They used to call it a joint mouse because it felt like, in the days before MRIs, like a little mouse running around inside your knee. So you can get mechanical problems. You're moving around and this thing's sticking and catching, and you have to get it out for that reason. Although for that to happen, that's usually a very large loose body, which usually you don't get so much from his injury. So, I mean, my guess is that they got the MRI, they saw it, they knew what happened, they figured they wanted to give him some time off, wanted to get the loose body out sooner than later. But I did think it was maybe a little unexpected that they shut him down completely after doing that. Makes you wonder if, maybe that crater was good size. But I don't want to speculate because there's no way to know.
No, but that's a great question because everyone's wondering, with this surgery, one, why did they know sooner? And two, is this going to affect what happens next year? Obviously, with the pandemic, if we get beyond that, they find a vaccine or whatever the case may be, and things return back to some sort of normalcy, will Ben Simmons be able to, return and play next season based on what he experienced with this loose body, currently? That's one of the big questions.
Yeah. I'll tell you one thing. So he's a really interesting player and fabulous athlete. All-star, couple years running, point guard at 6'10". But as is pretty well known, he scores, but he's just been reluctant to take outside shots. He basically, the whole last year, I don't think he took but a half a dozen three-pointers, if that. And he just doesn't like shooting from anything except, 10 feet or whatever on in. I will say this. And last year was supposed to be the year that he was actually going to shoot more, and he didn't. And I guess he figures, the team did well, and his game's good enough with that. But I do think that it wouldn't be a bad idea. Who am I to give advice? But this might be the time to work on your shot a little bit because, relying on being, a freakish athlete, if you lose a little bit of that, it may be nice to have a shot to fall back on.
Well, from your perspective, from my perspective, it is simply a logical perspective. Expand your game. And we've seen the superstars do it, whether it's Michael Jordan, whether it's Magic Johnson, whether it's, currently with LeBron James and Kobe Bryant, what they were able to do with their game to adjust to the game. Unfortunately, you talk about, in my opinion, Ben Simmons, and another player comes to mind, Giannis Antetokounmpo with the Milwaukee Bucks. The stigma on him is the fact that you're right. He won't shoot that outside shot as well. And even when the bubble, that kind of resurfaced that he doesn't have an outside shot and he can't shoot the three-pointer. And I know he and Kyle Korver were working on shooting those 3-pointers to open up his game. But Ben Simmons had the same type of style when he was at LSU, I believe, in the collegiate ranks. His pot of gold was at the rim to score. And athletes, as we know, are creatures of habit. And whatever got them there, they continue to incorporate that style of play. And I think that's probably one of the reasons those two players in particular, they make their bread and butter at the rim inside the paint area. And when you ask them to do something differently to help themselves out, as far as expanding their game from beyond the arc, they're not comfortable in doing that, and so they resort back to the game style that they're comfortable with and familiar with, and got them to that point, despite what anyone else may say. So, it is. I say all that to say, those are some great athletes, but you can't really expect them to change their game to the point where it's going to, make them better and elevate their teams to the next level, because in their mind, their mentality, that's how they play, that's what they're comfortable with, and that's what they're going to continue to do to reach their goals and to overcome their deficiency, so to speak.
Yeah, no, you're obviously right. I think Giannis a little more inclined to take outside shots, and he's taking some 3-pointers, and
he'll take on it.
Yeah,
I remember he's been working on it.
There's a press conference.
Yeah, he's still not comfortable to the degree that you want him to be. And when it's crunch time, if you watch his game and it's crunch time, he's not going to pull up for a 3. He's going to take it to the rim and do what he's comfortable with. But he has tried to expand his game to make it a entirely complete game. And when you're in the talks of MVP, it's hard to argue against that. But with Ben Simmons, he's still somewhat of a young player, and I believe he's still set in his ways, and it's going to take a little bit more time, maybe a couple more seasons for him to get comfortable with expanding his game, shooting beyond the arc. But right now, I think he's comfortable with, playing close to the rim.
Yeah, that's true. And again, what do I know? But I know that my daughter was in college in Philadelphia, so she was kind of following them some. So we used to talk about it a little bit. And he actually generated some heat from his coach, because his coach is Australian and Ben Simmons is Australian. And because he's a point guard that wouldn't shoot. Giannis is either a 4 or a 5 who wouldn't. So it's probably not the urgency. And so it just kind of puts a premium on having other shooters, since he really wasn't. So I don't know. Maybe this will be the thing. And I think I remember in the preseason they had videos of him, and he seemed like he could shoot it pretty well. He had a nice stroke. He just kind of wouldn't, and he's taking heat for it. I know Stephen A. Smith, for one, was saying they're going no place. This is last year before the playoffs. He said until he takes an outside shot, they're going no place. Maybe he's right, maybe he's wrong.
Yeah.
So, but
he's right. I think that coming into this after the long layoff, 142 days or something that there was a layoff from when this pandemic hit to getting back to the bubble. There were some experts out there that felt that Philadelphia was one of the teams to beat in the East, and that they were projected to challenge. Because think about it. Was it Toronto with the Kawhi 3 bounces that eliminated them? Yeah. So there were a lot of people around the country following the NBA that believe that Philadelphia, this could be the opportunity, the time for them to to stake their claim and make a run for it because of the personnel. And now you look at it today and you go, wow, what the heck happened? 2 of their key components are down and out, and this team is going, nowhere. So strange thing as far as the league is concerned, not only on the court, but, as far as injuries are concerned, and, the direction franchises and organizations can go almost in the blink of an eye. As far as the blink of an eye is concerned, I want to switch gears a little bit, Doc, with the Dr. Chad Prodromos on a weekly podcast, Sports Medicine Update. the National Football League, the players have reported the rookies were in camp a couple of weeks ago, and now the rest of the personnel, as far as the players are concerned, have reported up to their respective facilities for workout, albeit they're still, under protocol as far as COVID testing and social distancing as best as they possibly can. But we look at football and we see the physical specimen of these athletes, and it's amazing, over the years how we've seen the evolution of these athletes. They're bigger, faster, stronger, and we talk about bigger, and we focus a little bit on the offensive linemen and the defensive linemen as well. But you and I go back a little bit long in the tooth, and we talk about a 300-pound football player, and that, of course, William Refrigerator Perry with the beloved Chicago Bears and the '85 Super Bowl team. We know that the Dallas Cowboys in their dynasty run with Troy Aikman under center, and of course Emmitt Smith running the rock for them, they were behind one of the biggest offensive lines the National Football League had ever seen. We know that players now are well over 300 pounds because of the change in the game. But you and I have talked over extensive period of time as far as the health and life expectancy of these players once they leave the professional ranks of the National Football League. And we've seen some players who have really even gotten even bigger once they left the game because their diets and their workout habits have changed. But we've seen other players who have, if not maintained that playing weight, they've actually gotten smaller. And you've looked really deeply into this, and I want you to share with our viewers and our listeners, your thought behind the players and their physical being from playing to leaving the sport. Do you mind elaborating?
I've been aware of it, and I've looked into it more lately. The COVID thing's kind of brought it to bear because, as we talked about last week, a majority of the people who have opted out are linemen. And, you wonder why that would be. So you look at, what risk factors they have. So the combination of obesity and testosterone is a definite risk factor. So heavy men do worse with COVID. That's abundantly clear. But picking out the specific risk factors, so obesity by itself appears to be in a male. But the other thing is that obesity causes all kinds of other problems. Autoimmune problems, asthma, for example, is made worse by being heavy. Now, it's not to say if you're heavy with asthma and you lose weight, it's going to go away. But there's no question that overall it's made worse. Obviously, diabetes, definitely made worse. And there are young men who are diabetic or pre-diabetic. And so, I wonder myself, there's not a lot written, and that's probably a good thing, as to why so many linemen have opted out. And I don't know. I don't know if they see the obesity statistics, or if I know in the Bears, Eddie Goldman, right? It was just in the paper that he suffers from asthma, and he's a fabulous player. Oh my goodness, big and strong. And that's probably why he's not playing, because I read he is out with a designation of high risk. I think they get a little more money or something. But I just think I would love to see football turn back the page to where players were 30, 40 years. And the guys were big, but like we were talking about earlier, Roosevelt Brown, when I was a kid, Detroit Lions, one of the 100 best players of the, I think, 20th century, whatever, fearsome foursome, right? Defensive tackle. And he was 6'3" and 255, right? So if, he'd be a linebacker today. The guys that are 6'3" are 320, 330. And so a few statistics that are kind of interesting. So if you look at BMI, and I've got a little cheat sheet here prepared. So BMI, body mass index, and it's raw, and this is just size. There's a whole separate variable with body fat and just percentage of body fat. But so 25 is considered overweight. Now all NFL players by that, range or overweight because they're so muscular. 30 is considered obese. 35 morbidly obese. Say 40 is morbidly obese. But the numbers I came up on, which is kind of interesting, is that first of all, they used to say that NFL players died young. As I looked into it, I found out that it doesn't look like they do so much anymore, except that if you're heavy. So a BMI of 30 obese is said to take 3 years off of your lifespan. A BMI of 35 is said to take 8 years off of your lifespan. And a BMI of 40 is said to take 20 years off of your life. So then you say, well, what do those numbers translate to in terms of height and weight? Well, I'll tell you, 6'4" and 328 is a BMI of 40. So statistically, if you're that size, you cut 20 years off your life on average, obviously. So 6'4" and 328, I mean, that's average size, maybe below average. I don't know, nose tackles, defensive tackles. And I won't mention names. I was looking up some, players around the league, but there are people on the Bears that are bigger than that, and there are people all over the league, offensive line as well. So these players are big because they have to be big, but it's very unhealthy. And as I mentioned a few weeks ago, and I feel pretty strongly about this, and I'm going to try to see if I can. And see, the thing that really bothers me about it is the college players. I read an article from 2013 that said the University of Florida at that time had 12 or 14 players over 300 pounds. This is a college, and I'm sure it's more today. And this high school there had all these players over 250. So the problem is when the pros are that big, it trickles down. Now, here's the thing. When you get to be that big, there aren't too many people that are 6'4" and 320 that are ripped, And so what I'm saying is I would love to see it be the case that if you work out and you're big and really strong and your body fat is low, that's great. But when the guys put on an extra 30, 40 pounds of weight that's mostly fat, it maybe makes them a better blocker or they get the quarterback a little bigger, but it's terrible for their health. And what's even worse is, and this is nobody's fault, but they look at the pros. So then if you're playing in college and you want to be in the pros, you got to be that big. So now you're a college guy trying to be 320. And then if you're in high school and you want to go to a college, you're trying to be 250, 280. So there's all these people that are doing really unhealthy things to their bodies. And I think the whole thing could be rectified, make it a level playing field for everybody. And if you say, well, if your BMI is over 30, you can't play unless you get a body fat test, which is easy enough to do. There's these little machines where you just stand there and they test it. Unless your body fat is like under 20%. I mentioned this a couple of weeks ago. 20%, the running backs, the wide receivers have body fat that's like 9%, right? So 20% is not super skinny. But that could be done. I think it benefits everybody. I think the players would embrace it because then the guy that's 340, he doesn't want to be 300. If the lineman he's going against is 340, but if everybody's, getting down in size, it doesn't disadvantage him. I think then it trickles down to the college, it trickles down to the high school, and you'll literally save lives. I mean, people will live longer if that culture could be changed. The owner should like it because their players are going to stay healthier. The players are all about health, right? They're working on helmets that, you can't spear, you can't tackle, you can't crack back block. That's all great stuff. It should all be about health. So I think that at all levels, if you say, well, BMI has to be limited to 30, which is still pretty heavy, and if you want to be bigger than that, fine, but you've got to be ripped. It's got to be muscle, not fat. And for the COVID thing, in the UK, they are working on obesity as a risk factor because they know it's a risk factor.
Right.
That tends to not happen in this country for, I don't know what, social reasons. People get offended, I guess. But the NFL, I think, could set a great example. And I mean, there's precedent for doing this kind of stuff. I think they could set a great example. I think everybody would like it. I've been doing a little research on this. I'm intending to try to get it out there in the public dialogue, NCAA, IHSA in the state, high schools, the pros. I think you help COVID, you set a good example, you cut down on diabetes, on heart disease, on autoimmune disease. It's good for the culture. I think it's good for everybody. And I don't see any reason why it can't happen.
No, I think it's fantastic. I think you're right on point. And It's a great indicator to learn if these owners and these organizations are really concerned about these athletes, their health, their livelihood, and more importantly, life after the sport, life after football. Doc, there's more. I'm sure we're just touching the tip of the iceberg as far as this conversation, this topic is concerned. Definitely want to dive back into it a little bit more moving forward regarding the podcast. It goes real fast, but there's so much wealth of information and knowledge that's coming from this podcast, and we look forward to it every week. The Sports Medicine Update. If people want to get a hold of you, if they want to find out more about what Dr. Chad Prodromos does, and if you can help them, how do they get in contact with you, Doc?
Just call our main number. It's 847-699-6810, or you can email at ortho@ismoc.net. This question actually came from an email from a viewer listener. So we're happy to talk about sports and bring things here that are of interest, and always happy to see you as well to help where I can.
Well, I'm looking forward to getting more into this topic, this discussion, because it's definitely, we want to make sure everyone's out there having a grand time, having a fantastic time, enjoying themselves, especially with the beautiful weather that we're experiencing. So if you're out there playing golf, if you're out there shooting hoops, or if you're bicycling, swimming, whatever the case may be, we want you to be safe and sound. But if for some reason you sustain some type of sports injury, Dr. Chad Prodromos, Sports Medicine Update, the podcast, where you want to be to find your help, find your aid, find your support. And we love bringing it to you every week. No question about it. Doc, thank you so very much. We look forward to talking with you. Have a great weekend, and another edition of Sports Medicine Update podcast. Take care of yourself.
Thank you so much, Jerry.